ninth webinar session in this weekly webinar series Gyan Ganga-a Knowledge Voyage. To begin with, a warm welcome to our respected dignitaries, respected governing body members, respected Gurujans, respected speaker Dr. N. Bhaskar Rao sir, our respected distinguished guests, learned students and social media live viewers. I welcome you all. I also would like to pay sincere gratitude and pranams to our respected mentors and source of inspiration. Respected Padma Bhushan Vaidya Devendra Trigunaji, President of Governing Body RAV. Respected Vaidya Manoj Nestiji, Advisor Ayurveda, Ministry of Ayush. Respected Vaidya Anupam Srivastav sir, Director of RAV, for their valuable guidance, encouragement and motivational support to bring best of Ayurveda through this virtual platform. Today we are blessed to have with us very renowned physician and research analyst from Tirupati, Andhra Pradesh, our esteemed CRAV Guru, respected Dr. M. Bhaskar Rao sir. And today sir is going to share great insights and his expertise on a topic, Raktamokshanam, bloodletting procedures, a scientific overview with special reference to Buergers disease. As you all are aware that Buergers disease is an inflammatory occlusive disorder involving medium-sized arteries and veins in distal upper and lower extremities, and there is no specific treatment of this disease in contemporary medicine except regular exercise and antiplatelet therapy. But in Ayurveda, Raktamokshanam gives promising results in symptoms of disease. Today, sir is going to share great insights and his expertise on this topic. Now, with the brief introduction of our today's respected guest speaker, Dr. M. Bhaskar Rao sir, we will start the session. Sir is presently serving as CRAV Guru from Tirupati, Andhra Pradesh. Previously, he had been retired of a professor and vice principal at SP Ayurvedic College, Tirupati, Andhra Pradesh. Sir is university first rank holder and recipient of gold medal. Also is a good analytical research specialist with experience in experimental research and data analysis. Sir has completed BMS with gold medal from Kakatiya University, MD from Bangalore University, PhD from NIE Jaipur. He also possessed diploma in plant drugs. He had been trained in University of South Wales, Sydney, Australia in the year 2007. His field of specialization is Shalya Tantra. He is having 33 years of UG teaching experience and 7 years of PG teaching experience. He had secured 21 theses awarded for PG students also. He is one among panel doctors in ETV Sukhi Bhava channel, which is bi-monthly telecasted, and he has received Young Scientist Award as well for his surgical skills and extensive service of s.r.t application in high anal fistulae. He has more than 25 publications to his credit in regional and international journals. Recently, he had been awarded with Young Scientist, Young Investigator Award by ICIM Kyoto, Japan for his contribution of histopathological studies of s.r.t in high anal fistula, and Travelling Grant Award, Birmingham, UK in 2014. He had been invited as international guest speaker as well. He had 9 publications on his name, like Leech application in Ayurveda and recent advances on s.r.t. Now, I would like to request Dr. M. Bhaskar Rao sir to please proceed with the session. Welcome, sir.
Namaste.
Namaste.
Good afternoon to all respected dignitaries. Raktamokshanam, bloodletting procedure, a scientific overview with special reference to the Buergers disease. My special thanks to, are you able to hear, madam?
Yes, sir. Yes, sir.
My special thanks to Vaidya Devendra Trigunaji, Padma Bhushan Awardee, President of General Body of RAV, Vaidya Manoj Nestiji, Advisor, Ministry of Ayush, Vaidya Anupam Srivastav, Director RAV, to all Gurus of CRAV, New Delhi, and my Shishyas, Dr. Lakhan Trivedi, Narendra Yogi, and my special regards to Dr. Poonam and other staff. This is the God of Ayurveda, Dhanvantari, and who is holding leech in his hand, signifying the bloodletting therapy in the hand. Yes, coming to the topic, Raktamokshanam, bloodletting procedure, a scientific overview with special reference to Buergers disease. So, Raktamokshana is a unique, innovative parasurgical procedure where certain amount of blood will be removed from the systemic circulation to cure various anomalies which are not even possible by the medical management or by the surgical management. This is a miraculous therapy described as s.r.t 800 BC. So this picture signifies s.r.t performing various surgical and parasurgical procedures. Yes, this is the important.
Sir, now moving, sir. Sorry for interruption.
Please change the slide, sir.
Better?
Sir, we are on first slide, sir. Please move the slide.
It's okay, madam?
It's displaying first slide, sir.
Okay, I am changing.
No, we are on first itself, sir.
Oh.
Everybody, please stay connected.
Okay, madam, are you able to see the
Yes, sir. Sixth slide.
Raktamokshanam bloodletting procedure, the first slide?
No, we are on sixth slide, sir, right now. Sixth.
Okay. Now this is the slide which shows the points of bloodletting field of book medicine. Are you able to see, madam?
Yes, sir. Please proceed.
Yes. This is an important picture. This picture signifies the points of bloodletting by John von Buergers, a field book of wound medicine in the 15th century book. This is another painting, actually 15th century painting, ancient Greek painting in a way showing a physician bleeding a patient. So this signifies even earlier also, after s.r.t's arena, there at the 15th century, 12th century, there was a regular practice in Europe and India, elsewhere on the globe. The practice of bloodletting was existing. So this is another important picture, ornamentarium, 1693 picture, diagram, transfusion of sheep's blood. This is a debatable topic. Is it possible to transfuse the sheep's blood? But in an emergency basis, when it happens, so there was a practice of transfusing the sheep's blood also. So this is very important to young practitioners in the field of bloodletting. What is the difference? I mean, the relationship between the bloodletting and astrology. No, this is a really highly debatable topic. Different people, different astrologically related people, the procedures of bloodletting, where exactly it has to be performed, this signifies. So this is another topic to be debated. So when coming to the topic, the total surgery by s.r.t can be divided into three aspects: philosophical aspects, parasurgical aspects, surgical methods, super specialties. Parasurgical aspects, you know, Kshara Karma and Agni Karma. Surgical methods are Ashtaveda Shastra Karmas. The super speciality of surgical aspects is, to my knowledge, is Raktamokshanam, bloodletting, and also plastic surgery.
Excuse me, sir. Sorry for the interruption, sir. Please click on the slides which are on left side, sir. Then move with the downward arrow, sir. Then the slide will change.
Okay. Now, are you able to see Dr. Poonam, surgery?
We are on sixth slide, sir, right now. Just click on the slides which are on the left side, sir. Just one click, and then you can use the downward arrow to move the slides. Yeah, now moving, sir.
Okay. Now surgery is right. Hello, Poonam ji?
Yes, sir.
Are you able to see the surgery slide?
No, no, sir. We are on 6 slides, sir. You can click on this slides which are on the left side, sir. Then you can use downward arrow. Yeah, then it will move. Yeah.
Okay, we'll do this.
Yeah, yeah, yeah. 10 slides, sir. Surgery slide is visible. Yes. Yeah, now moving, sir.
Surgery?
Yes. Yes, surgery slide is visible.
Yes, sorry for the interruption. Surgery slide, surgery total philosophy can be divided into the three aspects: parasurgical, surgical, and super specialties. Parasurgical aspects consist of Charakarma and Agnikarma. Surgical aspects are Ashtavidha Shastra Karmas. Super specialty aspects are Raktamokshana and plastic surgery. Raktamokshana can be divided into non-invasive and invasive. Non-invasive Srunga, Jaluka, Alabu and Ghati, whereas invasive methods are PRADHANA and Siravedana. Next slide, madam. Are you able to see, madam?
Yes, yes.
So this is another important slide, signifies non-invasive methods and invasive methods. And the topic of importance today is whether when you consider Raktamokshana, bloodletting to certain amount to remove from the systemic circulation, whether can we consider Rakta as a dosha or not, being a surgical man, being the legacy of Shalya. So I consider Rakta as a Chaturtha dosha on the following grounds. The first ground is Vata Pitta Slesh Deha Sambhava Etaha Ta Eva Vyapannaha Pralaya Etava Tadai Vireva Shul Chaturdivi Sambhavistiti. As like Vata, Pitta, Sleshma are the doshas, Rakta can also be considered as the Chaturtha dosha, because Yasmat Raktam Vinaha dosha na kadachit prakupyanti Tasmat Yada dosham kalam vidyat prakopena. Without the presence of Rakta, the Vatari doshas cannot be transmitted, cannot be migrated. So Rakta plays a significant role in migrating, in transferring, in carrying all the three doshas. Thus, Rakta can be considered as one of the dosha. And important point is here Visrata, Radha, Spandana, Lauta, and certain other specific features like Anushna Shri Shonitam Guru Visrata. Features and above criteria, Rakta can be considered as a Chaturtha dosha. And Dehasya Rudram Moolam, Rudire Naiva Dharyate, Tasmat Yatnena Samraksham, Raktam Jiva iti Smrita. This is how, so Rakta plays an important role. So, coming to the parasurgical aspects, Raktamokshana is one of the parasurgical aspects. A bloodletting procedure. Yes, what do you mean by bloodletting procedure? Is nothing but withdrawal of often considered certain quantity of blood from a patient to cure or prevent illnesses and diseases. Bloodletting was based on an ancient system of medicine in which blood and other bodily fluids were considered to be humus. Yes, bloodletting with Shrunga, because Shrunga, Alabu, Jaluka are the regular procedures in non-invasive procedures. So Shrunga is using of cow heart in especially Vataja disorders, and this is based comparatively now with the Buergers principle. And procedure with Alabu, you can see in Kapha. So this is Botilgar. And the original photograph, this is actually, we could able to collect the original photograph from Vishaka, Manya area in Andhra. So this is how they are sucking the blood after giving the incision. Yes. How Raktamokshana is effective? Because Rakta Rakta as a vehicle. Rakta, the blood being the vehicle to carry and transport absorbed nutrients like oxygen, metabolites from place to place. So correction of any abnormality in the blood by taking it out solves a number of problems. The miraculous effect of Raktamokshana is because which never suffers from all the Tvat doshas, Grandhija vikaras, inflammatory disorders and skin disorders can be nullified with the Rakta dosha. And people question me often, Raktamokshana as a substitute to Panchakarma. What I would like to enumerate here is, you can perform the Panchakarmas on the regular basis wherever it is indicated. But what I would like to say is, if Panchakarma is not able to perform in the persons who are not deemed fit, in such a case, if it is required to exert the same or the more effect, Raktamokshana is a safe option, can be a substitute for Panchakarma. Raktamokshana, yes, Raktamokshana is very useful in preventive medicines like various skin disorders, Grandhi vikaras, inflammatory disorders, and other disorders. Raktamokshana can be safely practiced. If you regularly practice Raktamokshana, you can prevent various skin, tumor, and all benign disorders can be prevented and averted. And supremacy of Siravedana, because it controls all the doshas, a substitute for Panchakarma. And what I would like to, and the young practitioners and Shishyas, you can safely practice Raktamokshana in all types of cellulitis, erysipelas, lymphadenitis, axillary, whatever, tumors, benign, cysts, and all blood-borne disorders like erysipelas, vasculitis, hepatomegaly, splenomegaly, and even hematopoietic disorders, certain jaundice conditions, and eczema, psoriasis, obesity, and non-healing ulcers, you can safely and confidently you can practice. And Purva Karmas are the minimum Purva Karmas are required. Keep the patient on the table, Snehana, Svedana, and Lagu Ahara, and but rule out hemophilic conditions, certain conditions, infective conditions, hepatitis, HIV are to be ruled out. In Pradhana Karma, you can, once you keep the patient ready, and you can, after Sneha Svedanas, and you have to tie the Yantrana Karma is very important. Once you do Yantrana Karma, the ends of vein has to be exposed. Once the vein is prominent, then you can perform Sira Vyadhana by using IV cannula or by the Pranthur. And Pasat, the desired amount, once it is removed, the desired amount what we practice in the going of 80 to 1 ml in single sitting, and every week that has to be 6 to 10 weeks depending upon the front. Amount of the some any antiseptic cream, tie it for a while for half an hour to 1 hour, and just with the regular dressing give him lime water to prevent any sort of and the immediate Samyak Raktamokshana qualities are, the patient will feel light-weighted and will be relieved, and he feel very feeling of well-being, and you can observe immediately on the patient. The only contraindications for the Siravedana is personalities, timid personalities, exhausted personalities who have indulged Stree, Karshit, and immediately after Vamana Virechana Karmas, pregnant people and chlamydia people, hemophilic people, and the people who are suffering with the chronic disorders are to be avoided for the Raktamokshana. Yes. What are the changes will occur with the Raktamokshana? The diminution of the larger vessels is relieved. Position of the blood rendering it less stimulating. The proportion of becoming in consequence of it being reproduced with a greater facility than the other elements of the blood. So what happens exactly once you remove the blood from the systemic circulation? So there will be triggering of antibody antigen philosophy, and the iron content will be reduced, plasma content. So since the increased, so it which will definitely trigger the immunity.
Departments of voice both of you.
Poonamji, are you able to hear?
Yes, sir. Yes, sir.
Okay, thank you. Yes, there are, because leaching is one of the non-invasive procedure of Raktamokshana. It is very ancient. It was there in the regular practice in Ayurveda. Till on today, the practice of leech application is very important. So leech application amongst the Raktamokshana is very important, which has a certain specific indications like which works at pathological level. So pathological level, which is hastamatrantu pramanena, in certain lesions which are having the size and shape of hasta, that means localized lesions like dermatic lesions, eczema lesions are very effective. And pitta raktaja humoral reasons are considered, and disease wise Raktamokshana leech application can be safely practiced on the cellulitis, hemorrhoids, cystic growth, inflammatory edema, varicose veins, vasculitis, and other things. Even this can be practiced safely on the Krusha Durbhala Biruna. This is very important pre-leech therapy. You have to collect the leech and keep the leech for 1 week in the fresh water. Activate them by keeping the leeches before application in the turmeric powder, turmeric solution, where they will get activated. You can observe once the leeches are kept in the turmeric solution, they will be moving fastly. So pre-leech process is collection, activation, preparation of the spot. This is very important. And then actual process is keep the leech on the lesion wherever you want to keep, whether it is on varicose veins, whether it is a varicocele, whether it is an eczema, whether it is a diabetic ulcer, diabetic foot, where you want to keep the leeches on the area so it holds and which starts sucking. So once it starts sucking, 20 to 30 minutes or maximum of 45 minutes, it completes the process, which becomes a web-shaped, swollen, and most of the leeches will leave the area or otherwise keep some turmeric or the salt powder at its mouth, they leave. And once the leeches are left, you have to perform Vamana Karma to the leeches, otherwise they may die with a disease which you are aware, Indramada. A comparative chart of Raktamokshana I could able to prepare from Growth-Rays and Lagut-Rays. Various disorders are mentioned for Raktamokshana like Padadaha, Padaharsha, Apabahoka, Chippa, Shukadoshas, Unmada, Nasa Rogas, and Netra Rogas, Metra Rogas, and around 77 diseases have been identified from the Growth-Rays and Lagut-Rays. And for your information, and my dear respected gurus and shishyas, and leech therapy is well approved by the USA Food and Drug Control Authority, and now you can safely practice leech therapy, and officially accepted Royal College of Physicians leech therapy since long back. And now we are facing actually in the practice of leech shortage is there. There was a scarcity of leeches even in the 17th century. This is the information just I wanted to give, how it was significant, the leeches, even in the 17th century. Yes, bloodletting a life-saving measure, yes, even now, my dear friends, my respected scholars, now also bloodletting therapy, removal of the therapeutic amount of blood from the systemic circulation is indicated now also by the modern physicians in a condition like hemochromatosis, polycythemia, porphyria cutaneous tardy, hemochromatosis where the iron content is higher doses, polycythemia where the RBC content is more, porphyria cutaneous tardy where the blisters and hypersensitivity to sun. In these conditions, modern physicians even today now, they advise only bloodletting procedure. There is no modern medical management for these three diseases. It is inevitably has to be performed bloodletting for hemochromatosis, polycythemia and porphyria cutanea torbi. And import of leeches, even this is there 40 millions of leeches imported in 1830. It is now also the same condition. And this is leech therapy is called as Hiridino puncture because the puncture which is given by the Hiridino. And leeching now it is a great trend in the plastic surgery, especially for the reconstructive surgery. Leech with, for your information, it has 80 tiny teeth. And one important thing, so many students will question, can a leech transmit the infection? Absolutely no. It cannot transmit any sort of infection. There are various experiments on this. A leech cannot transmit any sort, including HIV, hepatitis B, anthrax. No, leech cannot. But the only precaution you have to take, once you use the leech in one particular individual, please continue the same. Don't change to other patients. This is only the advice I wanted to give you. Leeches are natural healers, eco-friendly, a symbiotic bacteria. For your information, what I would like to give, one important, a leech's gut will contain a bacteria called Aeromonas hydrophilia. This is actually which adds up a symbiotic effect in the therapeutic value too. And bloodletting, the scientific argument, what I would like to tell you, this can be used safely on the joint disorders. And coming to the leech therapy, one of the part of the Raktamokshanam therapy in the Buergers disease, you can see he is smoking, his fingers are gangrenous, tip of the fingers can be seen. He cannot, though he has gangrenous fingers, he never stops smoking. Cigarette tan on the fingers you can see, that is the culprit which causes. And as you know, Madam Poonam was also enumerating, Buergers disease is a small segmental median, it affects the medium-sized and small arteries, usually in the lower limbs and affects even to the upper limbs because of the aggregation, narrowing of the vessels. This assessment, the diagnosis can be made, the claudication distance, pain, diminished pulses, cold, red and cyanotic extremities. And the management in the modern system has no exact treatment. This is the arteriography of the Buergers patient. You can see, so diminution of arteries, only up to the carpal bones it is there, and metacarpals and the phalanges have disappeared. So the major symptom is claudication symptom, limping in the, I don't want to go to the symptomatic as you are thoroughly aware, which because it affects the medium and small sized arteries in the lower limb and as well as upper limbs. Majority of them will have leg pain, more than 50% of the patients. 33% will have typical claudication pain and 5 to 10% will have rest pain too, even after taking the rest, because it signifies the total occlusion of the small and medium-sized arteries. What Ayurveda says on the Buergers disease, this is nothing but another synonymous term is thromboangiitis obliterans. Vata Rakta is a disease due to the provocation of Rakta can be considered. So Damani Pratichaya Ashtanga Hridaya says Ganastra Vahika Janya Shoda are the synonymous. As you consider whatever you like, and the basic thing is Damani Pratichaya or Ganastra Vahika Janya Shoda, probably the appropriate terms. What exactly the Samprapti Gatakas? So dosha, when you look at it, is Tridosha. Dushya is the Raktaja, Srotas involved is Raktavaha, and Adhisthana is Adogami Damanas, and Srotho Dushti Prakara is Sangha, and Rogamarga is Shakasrita or Bahya Rogamargas, and Sanchara Sthana is Dhamani. And Samprapti Chakras, when you look at it, Tridosha Prakopa Viharas and excessive smoking triggers the immunological factors, formation of type 1 and type 2 collagen. This is signifies just like a AMA formation. AMA Yukta doshas elevates anti-endothelial cell antibody titers, and the increased HLA1, HLA54, this is nothing but AMA Yukta Rakta can occlude the small and medium-sized arteries, resulting in Buergers or thromboangiitis obliterans or the Thamani Pratichaya, why I wanted to tell you, which has a specific pathological sequence, is comparable with the modern grounds. Yes, mode of action, because in these conditions we have done a good number of patients of the Buergers disease, even in the upper and lower limbs, which signifies the local action, which has a capability of exerting the systemic action. Locally, local tissue is initiated with the withdrawal of congested and stasis blood. Biological active substance of least saliva can possess anti-inflammatory, vasodilatation and analgesic property. Systemic action is because it has a demo-visceral connections with a definite organ well known. Biological active substance will be released into the blood, and they are capable to render counteract on the aggregation of the arteries, removing the blocks. We have made a group A study with a general care, protection measures, abstinence from smoking. In group B, same procedure adopted with leash, and in the group exclusive leash application have done for a period of 2 months of study. So these are the age incidents, sex incidents, occupation, smoking, showing the incidents of Prakriti. Majority of them are Vata Prakriti. Type of pain, duration of pain, and objective parameter here, a Doppler study of the arterial system was considered to document the scientific basis of leash application. Claudication distance, occlusion, incidence of intermittent claudication site was taken, and a statistical evaluation. I will show you the photos regarding this. These are the objective parameter regarding the skin temperature, Buergers angle. Yes, this is the how a leech can be effective on the Buergers disease, which is because the heridin, whatever it contains, can reduce the factor 8 of coagulation. An apirase enzyme which contains can remove the thrombus. An enzyme, EGRIN, can reduce the inflammation process in the vessels. Esterase, an enzyme which will be released into the systemic circulation, can prevent the hypercoagulation. The betadine enzyme which will be released into the systemic circulation can digest the foreign protein material in the vessel, clearing the blocks. Hyaluronidase diffuses the blood and allows free flow. Histaminase produces. So dilatation action promotes the regeneration. So this is how a leech, because as on date there are 56 proteolytic enzymes are being released into the systemic circulation depending upon the pathology which is a intelligent creature, does not release on the all the proteolytic enzymes into the systemic circulation, selectively seeing the pathology present, which assess the pathology, accordingly which releases. And it is not that all the proteolytic enzymes will not be pumped into the systemic circulation. That is very important, you have to consider. Yeah, leech can be safely practiced in the goiter nodule. This was one of the study done by one of our PG students. And the case of Buergers disease with ulceration, application of leech. This is once it is fully blown, fully sucked the blood, removal just keeping some amount of haridra at its mouth, which will relieve the site. You can safely take off the leech from the site, which you can observe. It is fully blown, around 20 to 30 ml of the blood, which has sucked from the lesion. Two leeches you can see. If there is another case, there are 3 leeches which are working. See, this is a Doppler study. You can see the superior femoral artery normal, popliteal artery, there is a blockage you can see. This is the documentation. And you can see the anterior tibial artery with normal flow, posterior tibial artery with normal flow. Poonamji, are you able to see?
Yes, sir. Yes, sir.
Thank you. This is very important. You can see this slide, dorsalis pedis with segmental block. There is a blockage. The posterior tibial artery with normal flow and the dorsalis pedis with segmental block is relieved. See, the block is relieved after the leech application. This has been documented. This is Buergers upper limb. Very rarely you get the upper limb Buergers disease. Very rarely. This is one of the original patient 10 years back. See, you can see he is a heavy smoker. We could perform the leech which has sucked more than 30 amount of blood just hanging to the tip of his finger during leaching process. And see, after 4th week of treatment, so the black gangrenous fingers have turned into the normalcy. Within a 4 weeks of time, we could able to prevent the amputation from this patient who happened to be an auto driver. After 6 weeks of treatment, you can see almost all the normals, total normals you can see. Leech application to the foot. This is in the OP. So various other patients of Buergers disease, you can see the 2 foot, because we have to apply the affected lesion is lower limb, we have to apply invariably to the foot. And fully swollen leech after suction process, they have to be removed, and Vamana karma has to be performed to prevent the disease of Indramada. This is how we perform Vamana karma process. So just put the turmeric powder to the tip of its mouth or just exert little pressure to its tail. It vomits almost all the blood and becomes active again. Keep them for 1 or 2 days in the normal water, feed them properly, and they will alive and they are ready for work after a week of time. And I will show you some of the pictures before treatment with gangrenous finger. You can see the fingers which are almost gangrenous, advised for amputation, and they were referred back to our department. See, before treatment. During leaching process, you can see here how we applied leeches here. After treatment, the ulceration is coming down and gangrenous fingers have turned to be normal, almost normal, and fully swollen leech attached to the foot, fully swollen. See, this is another, with ulceration of Buergers disease. Some patients, around 10 to 15% of the patients will be having non-healing ulcers to the foot, which appears resembling to the diabetic foot. And after 6 weeks of treatment with leech, so almost at the verge of closure of the foot, and after 8 weeks of treatment with leech, totally healed ulcer, absolutely healed. And this is one interesting case, 24 hours of post-operative of the earlobe plastic surgical graft. See, 48 hours post-operative, one of the interesting case what I would like to show on this platform. 72 hours post-operatively, 6 days post-operatively, 2 months post-operative, almost reunion in totally. And really, I am delighted to share my experience on Raktamokshanam blood dating procedure, a scientific overview with special reference to Buergers. My special thanks to Devendra Trivunaji, Manoj Nesriji, Anupam Srivastava, all other senior gurus, Shishyas, my students, Lakhan and Narendra, and other staff, Dr. Poonam, Dr. Rohit, and other staff. I am really very much thankful to all of the staff for allowing me to deliver this small guest series of lecture. In fact, this is my second lecture on the platform of RAV. Thank you one and all.
Thank you very much, sir, for a very informative and highly knowledgeable session along with the clinical presentation. Thank you very much, sir, for enhancing our knowledge and understanding on this topic. Now, the session is open for question and answer. If anybody is having any question, they can ask. Please unmute your mic and ask. Any questions?
Ashok.
Sir,
Yes, please.
Congratulations for a very nice presentation. I'm sure our students are happy to know the clinical presentation, and they must have got a lot of information and confidence as well, as you have shown us the pictures and how to take the pre-operative and post-operative care and care of the leeches too. Thank you, sir. Thank you very much.
Thank you, sir. Thank you, ma'am. Anybody else would like to share their views or have any doubts, they can ask.
thank you, sir, for that wonderful session. Hello, am
Yes.
I audible?
Yes,
Audible.
Sir, is it not necessary to put the wet cotton cloth over the Jaluga during the process?
May I know your good name? Huh?
My name is Dr. Surya.
Oh, Dr. Surya, very good question you posed to me. It's only the pictorial purpose I removed the wet cloth, wet cotton strap. Usually we cover cotton which is soaked with the water continuously, as if naturally leech should feel as if it is in the water. That is very important. We should be continuously soaked with water. Otherwise, leech may not, leech may be irritated and cannot suck the appropriate blood from the system. That is very important. It's only photogenic purpose, photographic purpose. To have an easy demo, I removed the swab and took the photograph. Thank you for your keen observation. Good, Surya.
Thank you, sir.
Anybody else would like to share something or would like to ask any question? Any questions from the lady? Anybody else would like to ask? Please unmute yourself and ask.
Hello.
Yeah.
It was a good session, sir. Sir, I have a doubt.
Yes.
Sir, can you do alopecia with a leech therapy, sir?
Yeah, good question, ma. This is very interesting because my topic is confined to the Buergers disease. I don't want to go except some other photographs I have shown, like thyroid goiter and some earlobe removal. Very interesting. For the alopecia, if it is indicated properly, you do PRADHANA, taking all aseptic precautions and keep the leech there. For 4 to 6 applications would improve the condition, but you have to assess what exactly which causes the alopecia. That is very important. Pre-operative assessment requirement. You have to judicially select if it is indicated, if it is like seborrheic dermatitis of the scalp, if it is secondary infection with the psoriasis, if it is a condition related to any systemic other conditions which are feasible with manageable, which are not manageable by the other systems. Definitely you can take up, you can try, you can take a ditch. Definitely you will be succeeded. Good question.
Thank you, sir.
Thank you. Anyone else would like to ask? Yes.
सर कई बार जलोगा को बबन कराने के वो ब्लैकिश कुछ निकालती है सुबह का
Yes, please.
हाउ कैन आई तो निर्मित जलोगा
It's not audible, doctor.
Hello.
हाँ सर कई बार जब जलोका को बमन कराते हैं सर
Yes.
कई बार वो ब्लैकिश का कुछ निकालती है, ब्लैकिश थोड़ा स्ट्रिक्ट ब्लैकिश।
मैडम पूनम जी एक बार रिपीट करिए क्वेश्चन।
Yes, sir. Sir, he is asking कि whenever the Jaloka vomits, so some blackish kind of secretion is taken out. What is that? He want to ask.
Yeah, this is a really good observation from the doctor, because during the process of suction from the leech, when we keep it on the lesion, the leech serves around 20 to 30 ml, and the leech directly enters into the gut, which interacts with various proteolytic enzymes, like various proteolytic enzymes, some symbiotic bacterial invasion teaming would alter the original color of the blood during the process of vomiting. That could be definitely altered, like black. That original color of the blood could be altered due to the mixture of the enzymes which are mingled with the in the gut of the leech. Probably that would alter the color of the blood. Very good observation.
This type Jaloka is body harmful or not?
Pardon?
मतलब इस प्रकार की सब जलोका जो होती हैं वो हार्मफुल तो नहीं बॉडी के लिए?
Definitely not. Jalukas are never, cannot be. They are safe. The only thing is specific indication criteria has to be verified. They are safe. The only advice, my dear young practitioner, what I would like to tell you is, you take a set of 4 or 5 leeches, apply in one individual. Please don't change. Till the end, use them or add up new leeches. Once you practice on one individual, please stick on to that same criteria and never change, because in an urgency, if another patient comes, please don't use. Though they are safe, though they cannot transmit any sort of infection, but on ethical ground, don't use the leeches which have already used to one particular individual. That is the only care you have to take on ethical grounds.
Okay, sir. Thank you, sir.
Thank you.
Any next question? Anybody else would like to ask?
Hello.
Yes, sir. Your voice is breaking, Dr. S.r.t.
Sir, you had mentioned cellulitis.
Yes.
So in acute cases, if there is inflammation, can we go for leeches, sir? If it's acute.
Any cellulitis condition, including the vascular occlusions, venous thrombus, small segments which are occluded, even vasculitis conditions, non-inflammatory cellulitis, and you can see especially inflammatory cellulitis with even thrombus blockage, let it be Buergers or other related, like even in the varicose veins, you often see the foot edema. So non-inflammatory swelling. And inflammatory swelling, like as you said, the cellulitis, you can safely practice and you get instant results in such a condition.
Okay. If there is more of warmthness, sir, if it's more warm.
And better, no problem. You apply 4 or 5 leeches at a time and suck the blood around 100 to 150 ml of blood, and you see the results drastically. The temperature will come down, congestion will be reduced. Patient will feel very happy, rather to say the pain has come down, and he feel very happy, sir, I am very comfortable. So that sort of observation you can make out from the patient instantly.
Thank you, sir.
Yes. Next question. Anybody else would like to ask?
Hello, sir. Namaste.
Namaste.
Sir, you have told that for ethically we cannot use the same Jaloka for another patient. But actually, I wanted to ask you that after how many days you can use that Jaloka to another patient? Like you need to get some days like that.
Good question. This is a
problem
of not getting leeches properly, then you can think of. But nowadays you are getting leeches abundantly. On order, you will get the leeches abundantly. When you are getting leeches abundantly, why you want to make use of the same leeches to another patient? What is the fun? What is the purpose of using? Now, one thing, what a technical aspect, because you are posing a question for me, the technical aspect. Once you use it to one particular patient, after 2 weeks of the time, it was observed through the gut secretions, no bacteria, no virus, no protozoal element is survived in the gut of leech. In that case, after 2 or 3 weeks, after a single use in one another patient, can be reused to another patient. Since we are getting abundantly, looking at the ethical grounds, better you avoid. That is the only thing. But technicality, when you speak like that, definitely you can practice safely. But ethics are more important than the technical aspects for an Ayurvedic surgeon or an Ayurvedic physician, what I feel.
Anybody else would like to ask? Any more questions from the viewers? Okay, I think there are no more questions, sir. Thank you so much, sir, for a wonderful session, and it was a really interactive session. Thank you for being with us today. We are very happy. And now it's time to conclude our today's session. To extend a vote of thanks, I would like to request Dr. Paritosh Shah, please.
Thank you so much, ma'am. Good evening, everyone. It is an honor for me to have the opportunity to propose a vote of thanks on 79th webinar of Gyan Ganga, a knowledge-wise webinar series organized by Rashtriya Ayurveda Vidyapeeth. On behalf of organizing committee, I want to express my gratitude to our respected speaker, Dr. M. Bhaskar Rao sir, for his knowledgeable explanation on the topic, Raktamokshanam, a scientific overview with special reference to Buergers disease. Thank you so much, sir, for enlightening us with your detailed discussion on the topic. I would like to thank wholeheartedly respected Padma Bhushan Vaidya Shri Devendra Tirumalji, President Governing Body of RAV, for his blessings and continuous encouragement. I express my humble thanks to Vaid Manoj Reshi sir, Advisor Ayurveda, Ministry of Ayush, for providing us his immense support and guidance. I extend my heartfelt thanks to Dr. Anupam Srivastava sir, Director RAV, for his constant guidance and motivation. I must thank organizing team of RAV and the volunteers who work behind the scene for their tremendous effort to make this webinar series a great success. I am also thankful to all the respected Gurujanas and participants who are connecting with us continuously throughout the series in spite of their busy schedule. Topic and speaker for the next webinar will be shared with you very soon. I request all the respected Gurus to please share the topic soon with us for presentation in the Gyan Ganga. At last, I want to say, be healthy, be safe, wear the mask at all times, obey social distancing. With that note, I want to thank you all. Thank you so much, sir.